Okay, it is my pleasure to introduce Maddie Fowler. Maddie is a Rotary Global Scholar. She just finished her Master's of Public Health at, I'm going to say it in English, Maddie, and you can tell us really what it is that where you went to school, but it's a Catholic university in Santiago, Chile. She graduated this spring, and Maddie also graduated from Duke University in 2021 with a self-designed major in disability studies and ethical mental health care. Her passion is health equity for people with disabilities, and she aims to become a physician scientist, advancing disability justice in medicine. Outside of academia, Maddie loves mountain trekking, and we've seen some lovely pictures of those treks. She's done treks in the Appalachians to the Andes, and she also plays flute in the university symphony. So, well-rounded young woman. Maddie, please take it away and tell us about your adventures in Chile.
Hi, everybody. Thank you so much for having me. It is seriously an honor for me to be able to be in contact with y'all, and especially this international group of people from over 4 countries and at least 6 states, I was told. I think that's really incredible. And just a testament to how Rotary connects people all over the world. So it's incredible. And my apologies for the really difficult start this morning. I had some issues with my Wi-Fi and was unable to contact anyone, but I'm so happy I was able to finally get online. So I'm really looking forward to talking with you all, and love to have a good discussion at the end. And also, just if anybody there's something that comes up today that you'd want to even have a more in-depth discussion about, feel free to email me. We can have our own Zoom chat or anything that you'd like. So I'm gonna go ahead and share my slides. Let me see. One moment, please. I present this. Here we go. Okay, and I'll just please do let me know if it works. Now I'm gonna press present. Has it gone full screen? Okay, great. Well, thank you all so much again for having me. And I wanted to talk today a bit about disability justice, which is my motivation for becoming a Rotary Scholar, and then what things I did as a Rotary Scholar, and then finally end with a bit of my vision, what I'm doing now. So I was a Rotary Scholar in Santiago, Chile, in Pontificia Universidad Católica de Chile, if you wanted in the full Spanish version. And my Master's of Public Health there took about 4 semesters, 2 years, and I was focusing on disability health equity in my research during that time. So trying to switch there we go. Why am I interested in disability equity? Well, my brother was diagnosed with autism when he was 2 years old. And growing up, we've also discovered many other people in my family have different disabilities. I'd say my brother is really my main focus, growing up with him, learning about the ways that he really brings gifts to our family, as well as ways that he struggled with things in the world. The world can put challenges for him. And that has been my motivation for wanting to make the world a better place for people with disabilities. And I wanted to add a slide about the Rotary Global Scholarship in case y'all were not familiar with it. So this is a scholarship from Rotary International and local Rotary clubs that provides up to $30,000 in funding to support a graduate degree abroad in any country that you could pick in 6 areas of focus. So the peace and conflict resolution, disease prevention, water and sanitation, maternal and child health, basic education, literacy, and economic and community development. So my work, of course, was in the disease prevention and also a bit in the child health area. So it kind of covered a little bit of several of these areas. And over the time, I was connected with a Rotary club in Chile to support me, go to their meetings, and help me get settled. Now, in my undergraduate, I created a degree in disability studies. So I thought I would share what that's about. So disability studies is a super interdisciplinary program. It's a study of people with disabilities in terms of their identity, culture, and history, as well as the more medical things like psychology or um, multiple other biology, medical things that could lead to disabilities. But a really important thing to note is that disability can be seen as someone's identity. So it really shapes how they're how they go about the world when they leave their house and they're interacting with people. There can be stigma involved, and it's important to be able to study things like that. And ableism is the term that is used for discrimination based on having a disability. One important paradigm shift that kind of came along in terms of disability justice is that disability not only produces limitations, but that there's also a lot, having disability in our society really contributes richness and diversity and ingenuity to our society. So there are many famous people who have in fact even said that their disabilities contributed to the work they did. So with Stephen Hawking, he has there are comments of him saying that being paralyzed actually helped contribute to him and being able to think so much about these incredibly important questions. Frida Kahlo, if you might not have known, she actually also had physical disabilities and used in many of her paintings, she actually used some adaptive equipment to be able to create those paintings. So it's really cool to think about how disability adds to our world and why it's really important that we accommodate people with disabilities so that we can, benefit from all of the important things that they have to share with our world. Also, an important theme is that accessibility is for everyone. WHO reports 15% of our world has a disability. Right now, that's actually at 16%. That's gone up, according to a report in 2024. So almost every one of us in this call will either have a disability or know someone who has a disability within our life. I can probably say that with, almost 100% certainty that all of us are going to know or have a disability at some time. And so the truth is also accessibility will be an important part of all of our lives. And universal design is one principle related to accessibility that has an idea that we can design our world in ways that are accessible for everyone. That has everybody in mind, so we can all access things equally. So here's just one example of the stairs that has a ramp built in with it, rather than having a ramp you have to go to the back of the building to get in. That's kind of separated from the rest of the population being able to get into a building. Where if you have it like this, there's many other ways that you could do that. It doesn't have to be this exact set of stairs, but a way to integrate people with our architecture and whatever accessibility features we have. Another really cool thing about how people with disabilities contribute to the world is, for example, things like texting and video chat were developed in great, mostly because of the deaf population needing to communicate. And there are deaf people involved in that as well. So having having people with disabilities in our world contributes to things that all of us use. Ramps are also used, people if you're pregnant or maybe you're carrying a heavy box, and all of us use elevators all the time. So it's a good thing to think about accessibility as being helpful for everybody. There's a couple of views of disability there, which I think for now I will skip for time, but feel free to reach out to me if you want to know more. The most important one of these is the social model that was developed kind of later on, and it helps us. It says, what if we think about disability rather than a limitation that one person has that prevents them from working with being able to integrate in society, to thinking about what barriers does society put in to prevent an individual from being able to integrate into it. For example, I think many of us here have glasses. If glasses weren't invented, I think it'd be very likely that we'd have a really different experience. We'd probably, experience a lot more disability in our lives. And since, our world has created glasses, that's an accommodation, and now we're able to integrate almost fully into our world. And that's just one example. Of course, this model doesn't work for everything, but it's a really important way to think about things is how can we make our world better? How does our world disable people rather than people themselves being the ones with a limitation that needs to be cured in order for them to be able to fully integrate? Disability pride is an idea that people with disabilities should be proud of their disabled identities. Of course, disability can bring many difficult things in someone's life. And people can, want to cure that disability or to alleviate it in many ways, but also it brings important, it becomes a really important part of someone's identity, and everybody deserves to be proud of their identities and what that has meant for them and what they've learned from having disability. So there are 10 principles of disability justice that were created by several people who have disabilities in 2018. And disability justice in general is making sure that people with disabilities are treated equally and equitably in our world. In the healthcare system, there's a really important history of discrimination that has often not really been shared with us in terms of specifically people with disabilities. So there were campaigns for sterilization of people with disabilities up into the 1960s. And there are several, over 20 states in the United States still allow for sterilization of people with disabilities with certain, less open terms, but it is still possible in many states. There are various things, institutionalization. So beginning from the mid 1750s, 1700s to today, there are institutions that still have not closed. And some states like Tennessee are trying to create more institutions recently. Institutions are really huge congregate housing facilities where people with disabilities live. Often it prevents them from being able to integrate into society because they're kind of confined to this area. And often there's some faults in like enrichment and it being able to participate in activities that somebody really enjoys if they're in this facility. There have been lots of things that impact people with disabilities and their healthcare. Some of this history can now be seen in attitudes of people today and in physicians today. One really important researcher in this area is Lisa Izzoni. She's a wheelchair user and a researcher at Harvard. She found that first, 82% of doctors believe people with disability have a worse quality of life, but only 40% of physicians and doctors feel that they can provide the same quality of care to patients who have a disability. There's a really big, there's over almost 60% of physicians feel like they can't provide, equitable care to people with disabilities. It's a really important area. Ideally everybody needs to be trained because disability is such a great part of our population. It's 16%, as we said. It's also something that has shown up on a more systemic level. People with disabilities are less likely to report having received their needed medical care. Insurance is more likely to deny treatments for people with disabilities. People with disabilities also have a lower average income, which reduces even more their ability to buy and afford healthcare and access to healthcare. So in the end, that leads to higher rates of disease and also a lot of problems in access to healthcare. So only 1 in 3 people with disabilities do not. So 1 in 3 people with disabilities do not have a usual healthcare provider, for example, and also 1/3 of them have an unmet healthcare need. So these are statistics that are, a really significant part of our population. And that does lead to disproportionate healthcare risk. People with disabilities were more likely to contract and to die from COVID-19. In the bottom, we have a graph from New York, and you can see how people with disabilities in Pennsylvania had almost twice the rate of COVID as people without disabilities. They're also 5 times more likely to experience sexual assault, 4.6 times more likely to experience mental distress, and have higher rates of many diseases just across the gamut, including diabetes, heart disease, obesity, many things that we can't go into today. But there's a huge all of these systemic issues have resulted in a huge issue and a huge over representation of illness and disease in people with disabilities. So here I have some, before we get into my story, just have a list of some reading that's on the basic theories of disability justice, if anybody is interested, and I can share these with you later on as well. So time to talk about what I did in Chile. I was at Universidad Católica de Chile, as I said. This is a picture of me with my classmates. All of my classmates were actually significantly older than me, and we're all already established physicians or policymakers, and we're doing the master alongside me. So it was a really incredible experience to be able to learn from them and how they deal with all everyday issues that I haven't even encountered yet because I'm not a doctor. And how those things relate to disabilities as well. It was really interesting. Here's a photo of our school right here. That's where I took classes. Outside of school, I participated in a lot of service activities in at least 3 different groups. So I worked with my local Rotary club and we did several free health clinics where I went and helped to set up, attend all the doctors that were there, make sure they had everything they needed, transfer people between rooms, all those types of things. I also did similar activities with the Special Olympics in Chile that they have a health program. So they do free clinics in special education schools where all the students have disabilities and are very likely to have limited healthcare access in these areas. And we found things like heart problems or even partial blindness that had not been found earlier in some of the patients. So it was really important to have this access to healthcare. They go annually to these schools to provide checkups. And I also was in a group called Calcuta UCE, which went to hospitals, and we accompanied pediatric patients who didn't have their parents with them, just to give them some moral support. Additionally, I engaged in other activities at the university. So I was part of the orchestra, and we did many concerts of classical music. We were funded to go on a tour in southern Chile. This is a photo from that. We went to multiple towns and played Handel's Messiah with local opera choirs in each of those towns, which was really fun and a great way to get to know people in other areas. I also participated with a professor in writing a policy brief, which is this middle image, and was published in the end of 2022 about the health and about sexual health and sexual and reproductive rights for people with disabilities in Chile. And I also made a ton of friends. You can see in this right-hand photo. That was my goodbye party, where all these people came in and later on they signed the flag with some messages, and it was really lovely. So I had a great experience of making friends there that I will, follow for the rest of my life. And I ended my project with my thesis. My thesis was looking at the utilization of healthcare services by people with disabilities in a specific area of Santiago, Chile. And this, so through this, I was trying to see which factors most increase or decrease people's probability that they will go to the doctor. And in this case, it was if they went to the doctor or did not go to the doctor in the past 12 months. So ideally, everybody should have done that, at least for their annual checkup, right? And I did this with I was looking at data from a database that was created by WHO in 2019. What I found in general was that I found several things, but the most important things were that having an assistive device, depression or anxiety were associated with higher use of rehabilitation services. The assistive device here is really interesting because it could show that providing an assistive device like a wheelchair or a cane could help people provide access to be able to reach the healthcare facility. And also facing barriers in public spaces was associated with lower frequency of rehabilitation use. So that could mean that people who are facing accessibility issues in our society and maybe the sidewalks or distances or weight or anything that could prevent them from going into sorry, that could prevent them from going out into our world can also reduce their ability to go and receive the rehabilitation services that they need. So by the end of my time in Chile, I graduated tied first position for my Master's of Public Health class. I earned maximum distinction for my master's thesis. I published one policy brief, and my thesis paper is currently being submitted and written, rewritten for peer review. I served over 150 hours in free health clinics and hospitals and performed in over 15 free public concerts with the university. So now I'm back. I arrived about a month ago to the United States, and just a few days ago, I moved to Nashville, Tennessee. I was accepted to the MD PhD program at Vanderbilt University. I'm going to be here for 7 years, earning both a doctor's and MD to be a clinical doctor, medical doctor, while also earning a PhD so I can be a researcher and continue investigating policies and practices that allow people with disabilities more access to our healthcare system. That will be my focus, and my PhD will be in health policy and health services research. All of these things are pushing me towards my dream and career goal, which is to become a clinician scientist, advancing health for the global disability community. I want to ensure that people, not just in the US, but across the world, I want to help to break down barriers that these people experience in accessing their healthcare system and even in the perceptions that they receive from providers, for example, training providers on how's the best way to interact with someone with an intellectual disability, for example. So I'm really excited. This is, happening right now. I just moved here a couple of days ago, and I'm so excited to get started. There's the Kennedy Center for Intellectual Disabilities here at Vanderbilt, and I've been working with them as my first lab rotation. They seem like a really incredible group. So finally, the last thing, and the main reason I wanted to come today was to say thank you to all of you Rotarians for everything that you've done to support people like me as global scholars. That this allowed me to have an experience and gain skills that are going to just catapult me into my career and have changed my way of thinking in so many directions. And it couldn't have happened without Rotary. So I cannot express how thankful I am for Rotary. Thank you.
Thank you, Maddie. And at the end of this, after we've asked Maddie some questions, I'll provide a little bit more context about the Global Scholar Program. Because Maddie, as you said earlier, the people on this call will probably have never even heard of the program because we're all new Rotarians almost. So this is a brand new concept to them. So anyone have questions for Maddie?
Well, first of all, Maddie, I just want to thank you for the presentation. And as you spoke about, even the visual, the glasses that Marie and I are wearing. And just Monday, I went to work and I was rushing and I left my glasses. And I was totally not being effective that day. So, and I did not even think to the degree that a disability like that. So really thank you for bringing more awareness, how we can be more mindful to identify people with disability and limitation and be more compassionate and helpful and accommodating. So really thank you for bringing that awareness even to me as you spoke.
Thank you so much. I really appreciate it. And I do feel like when I heard about, I didn't come up with the glasses idea. That was something I heard from my professor in disability studies. That's one of the first things she shares with everyone because I feel like it's a really helpful thing to show that disability really does impact everyone. But thank you so much. I appreciate your comments.
I wanted to say thank you for your presentation. I learned quite a lot from it. I've been a user of an assistive technology before. I was a wheelchair user for 2 different distinct periods, and it was eye-opening how much there is a cosmetic approach to disability. For instance, curb cuts that are so deep that you can't get back up them. Bathroom stalls that are longer than they are wide, so you can't turn your wheelchair around in them, that sort of other thing. What can we do to help people see that those cosmetic changes are not the solution that they think they are?
Absolutely. I think there's a couple ways that people can go about that. I think one thing is we need more representation of people with disabilities in our government and in positions that are going to be building those things. For example, you said you couldn't realize that the steepness of the curb was too much until you had to do it yourself. And so having people with disabilities in these decision-making areas, providing them positions of actual decision-making power to be able to, to make sure that our world is designed correctly for them. And then of course, there's also things that can be done, on a local level. When you find something that looks inaccessible, you can report it, to local government agencies, and of course, advocate for people that
Limited.
yes, for people that advance disability justice issues. And also in your everyday lives, we often don't recognize that all of the little biases that we have related to disability really can end up creating real harm, like real differences in harm in how people with disabilities experience our world. Because what we might think is, oh, it's just a curb cut, that seems like that it doesn't make a lot of difference, that it can actually really be a huge impact on people's day. And then that also goes with, how we talk to people with disabilities in our daily life, and so many other things. So being an advocate just in your life with the people that is also really important when you see someone say something, and being able to correct them kindly. It's really has a big impact too.
Thank
I
you.
gotta say that your first statement, with disability, despite my disability, and to move away from that and to start thinking in a different term really resonated with me, because I'm a person who has used that kind of language. Despite you, I will do this. Despite this, right? And when you said it, it was very resonating that, hey, I don't need to say it despite. I need to actually say because I will. and this is how I can change the perception one person at a time, right? So I truly appreciate it.
So Maddie, I want to thank you deeply for this presentation. I think it's opened my eyes. I think it's opened everyone's eyes. But I would like to bring this back to the club for a moment. You know, I think you know that we're a cause-based club, and we support a high school for the deaf in Kingston, Jamaica. Unemployment amongst the deaf in Jamaica, I used to say it was 50%. I just found out recently it's closer to 80%, unemployed or low income. So one of the things we've thought about in this club is developing a vocational training program for the students at the high school. And actually, that's the easy part. You know, whatever the skill set is that needs workers in the community, we can train them to do that. The harder part is, how do you integrate the deaf into the workplace? You know, there was a fairly recent survey said that 94% of employers in Jamaica think that they would be willing to employ the deaf.
Wow.
But the vast majority of those struggle with, how do you integrate the deaf into the workplace? And so I think if we develop this vocational training program, we need to be thinking about that part. And it may be easier today with modern technologies, you know, like electronic platform, communication platforms. I don't know yet. I haven't thought about it. But I think what Maddie's saying about equal access, about public barriers, should have a special meaning for us in this club because of the population that we work with. I just wanted to throw that out. And once again, thank you, Maddie.
Yeah, thank you so much. Because I think, and this is a thing that we've seen in employment programs even in my home state, North Carolina, for example, that you can provide as much job training as you want, and people can be, you know, very qualified. But then there's another issue of of employers, you know, knowing that and, you know, feeling accepting of hiring people with disabilities. And then there's access of, even if they do want to hire them, maybe they don't have the training or don't know, you know, these workplaces haven't been inviting to deaf people or people with disabilities in the past. So there needs to be some sort of change in the workplace environment as well. And I mean, one thing that people are doing now is putting in trainings for employers as well as, you know, as we're training people with disabilities, we should also train employers for how we can make our environments more accessible.
Wow.
I want to thank you, Maddie. I have a daughter who has learning disabilities, and, you know, think of the impact our educational system has on providing the resources for that. And I do have a question for you too. So why did you pick Duke? And for everybody here, that's one of the top universities in the entire United States for sure. So was that a good experience for you? And what can you tell us about that?
Sure. Yeah, I grew up in Chapel Hill, North Carolina, which is just a 15-minute drive from Duke University. So it was a huge part of my life growing up, and I was able to learn a lot about it. But one of the biggest reason, well, in addition to location, being near my family, was that it has the Center for Autism and Brain Development, which is a really big center. It has this researcher, Dr. Geraldine Dawson, who has been really important in the autism community. And I worked there for most of my time as an undergrad. So I really wanted to have a place that had a really big opportunity in terms of autism and being able to work with that community and being close to my family, which is important.
Right.
But Maddie, could you make sure that I have your contact information? I would love to be able to use you occasionally as a resource. You know, you mentioned the Autism and Brain Development Center at Duke. I had no idea it existed. One of the things that's on the table for consideration right now is bringing teachers of the deaf from Jamaica to the US to learn modern techniques of teaching the deaf. And to do that, we need to find the resources in the United States. Actually, preferably find the resources in the North Carolina general area. I would love to be able to contact you at some point in the future and pick your brains.
Absolutely. I mean, if it works, I can put my email in the chat.
Yeah.
Okay. And anyone who would like to contact me is welcome to do so.